The 30-Day Diabetes Cure. What if you could reverse your diabetes in just 30 days without expensive drugs, painful injections, or constant blood sugar monitoring? What if the cure was not hidden in some expensive medical procedure, but sitting right in your kitchen cabinet? Today, we are exploring the 30-Day Diabetes Cure by Dr. Stefan Ripich and Jim Healthy, a book that promises to free you from the chains of diabetes dependency forever, the crisis that changed everything. The introduction asks a haunting question: will diabetes destroy modern civilization? The book reveals the staggering increase in diabetes throughout the 20th century and the crushing cost to countries around the world. But Dr. Stefan Ripich, a naturopathic doctor, discovered something. Uncontrolled diabetes causes people to literally waste away, losing their mobility, eyesight, and independence. But what if this outcome was not inevitable? What if diabetes was not the life sentence we have been told it is? The revolutionary promise. Dr. Stefan Ripich will show you a remarkable 30-day diabetes cure that is freeing thousands of diabetics from the expense and dependence on diabetes drugs. Test strips, glucose monitors, expensive supplements, and medical procedures. Tens of thousands of people with type 2 diabetes have already transformed their lives using this method. Here is the bold claim. His program has achieved a 100% cure rate for patients who follow his advice, by stimulating the body's natural ability to heal itself. This is not about managing diabetes. This is about eliminating it completely. Understanding your body's healing power. Dr. Ripich's approach is built on a fundamental truth that most doctors ignore. Your body has an incredible ability to heal itself when you give it the right conditions. Diabetes is not a genetic death sentence. It is largely a lifestyle disease that responds dramatically to lifestyle changes. Think of your pancreas like a tired employee who has been overworked for years. Instead of firing this employee with drugs that bypass pancreatic function, imagine your blood sugar regulation system as a garden that has been neglected. Instead of constantly applying artificial fertilizers, medications, you start by improving the soil, removing weeds, and providing natural nutrients. The garden begins to thrive on its own. The cornerstone of Dr. Ripich's program is the Diabetes Healing Diet, which works in phases over 30 days. Week 1 focuses on elimination and stabilization. Phase 1, remove the poison. The first step is eliminating what Dr. Ripich calls diabetes-promoting foods. These include all refined sugars, processed foods, white flour products, and artificial sweeteners. But here is the twist. You are not just removing harmful foods. You are removing the addiction patterns that keep you trapped. Most people think they lack willpower when they crave sweets. The truth is, these foods create actual chemical dependencies in your brain. Break the cycle, and the cravings disappear naturally. Instead of fighting cravings with willpower, you replace addictive foods with naturally satisfying whole foods. Your taste buds reset within days, and foods you thought were bland suddenly become delicious. Phase 2. Flood your system with healing nutrients. Week 1 introduces what Dr. Ripich calls healing superfoods. Nutrient-dense whole foods that specifically support pancreatic function and blood sugar regulation. Key foods include cinnamon, which mimics insulin activity, bitter melon, which helps cells absorb glucose, chromium-rich foods, which enhance insulin sensitivity, and alpha-lipoic acid sources, which protect against diabetic complications. Your morning routine transforms from sugary cereal to a superfood smoothie packed with cinnamon, berries, and protein powder. Your blood sugar stays stable all morning instead of crashing by 10 a.m. Week 2 activation. The movement medicine. Week 2 introduces what Dr. Ripich calls movement medicine. Specific exercises designed to reverse insulin resistance and activate your body's glucose-burning machinery. This is not about grueling gym sessions. Dr. Ripich's exercise protocol focuses on brief, targeted activities that specifically improve insulin sensitivity. The key insight: muscle tissue is your body's largest glucose disposal system. Activate your muscles properly, and they become glucose-hungry machines that naturally lower your blood sugar. The secret weapon. Resistance training. Short bursts of resistance exercise create what Dr. Ripich calls glucose vacuum effects. When you challenge your muscles, they desperately need fuel to recover. This creates a natural blood sugar lowering effect that lasts for hours after exercise. 5 minutes of bodyweight squats after dinner can lower your post-meal blood sugar more effectively than many medications. Your muscles literally suck glucose out of your bloodstream to fuel recovery. Stress mastery. Week 3, transformation. Week 3 addresses what Dr. Ripich identifies as the hidden diabetes trigger: chronic stress. Stress hormones like cortisol directly interfere with insulin function and promote blood sugar spikes. Most diabetes programs ignore this crucial factor. Dr. Ripich introduces simple stress reduction techniques that have measurable impacts on blood sugar control. This includes breathing exercises, meditation practices, and sleep optimization strategies. The cortisol connection. When you are chronically stressed, your body constantly produces cortisol, which tells your liver to dump glucose into your bloodstream. This creates a vicious cycle. Stress raises blood sugar. High blood sugar creates more stress, and the cycle continues. A simple 5-minute breathing exercise before meals can lower your stress hormones, enough to improve post-meal blood sugar by 20 to 30 milligrams. Your nervous system shifts from fight-or-flight to rest and digest, allowing proper glucose metabolism. Week 4. Lifestyle integration and long-term success. As long as you continue to employ the healthy living behaviors in the 30-day diabetes cure diet, you can be diabetes-free for the rest of your life. Week 4 focuses on making these changes permanent and sustainable. The habit stacking system. Dr. Ripich teaches a system of habit stacking where you attach new healthy behaviors to existing routines. Instead of overhauling your entire life, you make small modifications that compound over time. You already brush your teeth every morning. Stack a 2-minute stretching routine onto this existing habit. Within weeks, the movement becomes automatic, and you have created a new health-promoting ritual without relying on motivation. Advanced healing protocols. For people with more advanced diabetes or complications, Dr. Ripich provides specialized protocols including targeted supplementation, advanced dietary modifications, and healing strategies for specific complications. The supplement stack. While Dr. Ripich emphasizes that food should be your primary medicine, he identifies key supplements that can accelerate healing. Chromium picolinate for insulin sensitivity, alpha-lipoic acid for nerve protection, bitter melon extract for glucose metabolism, and cinnamon extract for insulin-mimicking effects. Healing diabetic complications. The book addresses reversing diabetic complications through targeted nutrition. Diabetic neuropathy responds to B vitamin therapy and circulation-enhancing foods. Diabetic retinopathy improves with antioxidant-rich foods and blood sugar stabilization. Even diabetic kidney damage can be slowed and sometimes reversed with proper nutrition. The science behind the magic. Dr. Ripich backs up his claims with extensive research showing how lifestyle interventions can be more effective than medications for type 2 diabetes. Studies demonstrate that comprehensive lifestyle programs can achieve diabetes remission rates of 40 to 60%, far higher than any medication. The mechanism is straightforward. Remove the dietary and lifestyle factors that cause diabetes. Provide optimal nutrition for healing, and give your body time to repair itself. Your pancreas regains function, your cells become insulin sensitive again, and your blood sugar normalizes naturally. Real patient transformations. The book includes dozens of case studies of people who followed the 30-day protocol and achieved remarkable results. Patients report: normal blood sugar levels within 30 days, elimination of diabetes medications, weight loss of 20 to 40 pounds, increased energy and mental clarity, reversal of diabetic complications, freedom from constant blood sugar monitoring. One particularly striking case: A 58-year-old man with a hemoglobin A1C of 10.2%, dangerously high, followed Dr. Ripich's protocol. After 30 days, his A1C dropped to 6.1%, nearly normal, and he was off all diabetes medications. Your 30-day implementation plan. Success with Dr. Ripich's program requires commitment and systematic implementation. Here is your roadmap. Days 1 to 7. Foundation phase, clean out your pantry. Remove all processed foods, sugary drinks, and refined carbohydrates. Stock up on whole foods, vegetables, lean proteins, and healing spices. Start taking baseline measurements: weight, blood pressure, and blood sugar levels. Days 8 to 14. Acceleration phase. Add the movement medicine protocols. Start with 10 minutes of resistance exercise every other day. Implement stress reduction techniques. Begin tracking your progress daily. Days 15 to 21. Optimization phase. Fine-tune your diet based on your body's responses. Add targeted supplements if needed. Increase exercise intensity gradually. Focus on sleep optimization and stress management. Days 22 to 30. Integration phase. Lock in your new habits. Plan for long-term sustainability. Address any remaining challenges. Celebrate your transformation and commit to maintaining your new lifestyle. The mindset shift that changes everything. Dr. Ripich emphasizes that the most important change is mental. Stop thinking of yourself as a diabetic who needs to manage a chronic disease. Start thinking of yourself as a healthy person who is healing from a temporary condition. The authors inspire you to take control of your health and turn your condition around with conviction and daily commitment. This is not just about following a diet. It is about reclaiming your power over your own body. Your takeaway challenge. Dr. Ripich has shown thousands of people that diabetes does not have to be permanent. His 30-day program proves that your body has incredible healing capacity when you provide the right conditions. Here is your challenge. Commit to just the first week of Dr. Ripich's protocol. Remove all processed foods and refined sugars from your diet. Add 10 minutes of daily movement. Practice 5 minutes of stress reduction before meals. Track your blood sugar, energy levels, and how you feel. After just 1 week, you will likely see improvements that your doctor told you were impossible. This is not about perfection. It is about giving your body a chance to show you what it can do. The medical system profits from managing your diabetes, not curing it. Dr. Ripich's approach puts the power back in your hands. Your diabetes may have taken months or years to develop, but your healing can begin in just 30 days. The question is not whether you can reverse your diabetes. The question is whether you are ready to commit to your own healing.